through, like going for 3 weeks now. I had a minor accident, and I had a POP cast since about 3 weeks now. So that is really, like confined me to the house. I've not even seen outside, like in almost 3 weeks. But it's okay. That's all right. So I don't know what you're going through yesterday. I came online for live streaming, and I met a particular guy, and it's so heartbreaking what this guy was going through. He has been in jail for since he was 23, and he's 31 in his country. I don't know what he did. He couldn't say those things online, but he has been convicted, and he will be built for execution tomorrow. So when you think you're going through uh, problems in this life, and all you could see is you see people with the bigger problems, and you are overwhelmed. You understand? Because it's not easy to be a and watch your child being executed, being hanged. Like, easy. It's not easy. So because of this, I just want to talk tonight. Yesterday we had, uh, you know, we talked about what are some of the causes of fertility, and when we said those days it was believed that it is only female that are fertility issues. But as time goes on, we began to know with testing and various investigations that men too do have fertility issues. It's not only women that are infertility. The definition is just that you have been having regular sexual intercourse for like minimum of 1 year, and there is no pregnancy. Not that the husband is in the north and the wife is, and you are having minimum of like 3 times of sexual intercourse every week. You understand? Minimum of period you are meeting regularly, and you are not able to achieve a pregnancy, then you can say you are going through infertility. And talking about infertility, those days, it was only the women that were subjected to various investigations, go and do HSG, do your hormonal assay, do abdominal scan, abdominal ultrasound scan, a lot of things, even infection, vaginal swab. They put women to test various investigations, and particularly that HSD is very painful. There is no woman that will do it that will be smiling. It doesn't come easy. Apart from the finances, it's financially draining. Looking for babies is financially draining. You understand? And most people, some might not even want children, but for some that want it, and the pregnancy is not coming, it is financially draining, it's emotionally draining, it's psychologically draining, everything draining, materially draining. Even at times, the relationship might be strained. You understand? So, talking about infertility, it's a problem for both male and female. So, these days, when they come, we no longer do as usual. It's no longer business as usual that you, the man, go and do, you, the woman, we subject you to this and this. You, man, go and sit down. Let's see how the test, because I've seen that several times. But now the narratives are changed. The narratives are changed. So when they come this time around, we put the two of them, we subject them to various investigation, various history taking, to know where they are coming from, where they are, and probably where with what have happened in the past. Maybe there has been a history of maybe previous abortion, previous miscarriages, family history of infertility. Maybe there have been period of not properly treated sexually transmitted infection. It's one of the things that can cause it, like PID that is not properly treated. A whole lot of them like that. So when we're talking about infertility, it is when you have had regular sexual exposure for minimum of 1 year before we can say you have infertility, uh, or you have fertility issues. Now, in women, we're going to be talking about some of the causes of fertility, infertility rather. Then when we're talking about infertility, number one thing that usually happens is what we call idiopathic. Idiopathic means they have done all manners of investigations, both blood tests, various scans, like HSG. HSG is just an investigation that is done if there is blocked fallopian tubes that will be used to, it's both therapeutic and investigative. You understand? We can use it to diagnose. You understand? It's diagnostic in nature and it's therapeutic because sometimes we just want to know if that tube is patent, that egg can pass through it. That is diagnostic. We want to do tests for that to diagnose you if there is problem with the fallopian tubes. But now it can also be therapeutic in the sense that when the probe is being inserted to do investigation to know whether the fallopian tube is blocked, it can really open up. So that is the purpose of HSG. So they put women through that. They put you through blood investigation. They put you through hormone investigation. They put you through abdominal ultrascan, pelvic abdominal scan, and a whole lot of things. And they have seen that there is no problem with you. As a woman, they can say is idiopathic. Idiopathic simply means we don't know the cause. The actual cause is unknown. Then apart from that, it can be as a result of hormones itself. And when we're talking about hormones, there are various hormones that are responsible for releasing egg, for ovulation, to prepare your uterus, to prepare, you for pregnancy. Working with the ovary, some working with the uterus itself. There's a place in the uterus, we call it endometrium. That is the innermost layer of the uterus. Now, these three places, they are being prepared for pregnancy. But this time around, it depends on the level of hormone. If you have lesser hormone that is not enough to trigger ovulation, that is not enough to trigger pregnancy or egg release, or to help the ovary, to help the fallopian tubes and all that, there is a problem. Because that problem, what will happen most of the time, the eggs might not be able to release. The ovary might not, there's nothing knocking on the door of the ovaries at ovulatory time. That, oh yeah, let's go. You have to release egg. Is mid-month or mid-period or something. So it can be hormonal problem. So most of the time they will ask you, if you're going through fertility issues, to go and do hormonal assay. They just want to know, is the hormone in your body, are the levels okay, either too low or too high? Sometimes like hormones like prolactin, that prolactin is the hormone of breast milk when we are pregnant. But if you are a single person, or you are still waiting on babies or something, or you are married and you are not pregnant, and you have not had abortion or something before, you have not had miscarriage or a stillbirth, and there are prolactin, there is breast milk in your breast that is coming like that, you have to go and do something about it, so that the doctors will give you there are some medications that can be given to you to dry it. If not, your body might not be able to allow your ovary to produce egg for pregnancy to take place. So we've talked about the hormonal problem. And we've talked about the idiopathic. Idiopathic is that we don't know. Then we have something we call autoimmune disorder. Autoimmune disorder is just a disorder whereby the tissues and the cells of a particular place in the body, like the ovary, for example, they begin to attack themselves. They are fighting against themselves. They are fighting against them. They are not able to allow, they will not allow the ovary to do its function, which is the function of releasing eggs. You understand? So when it happens like that, there is a crisis. Pregnancy might not be able to take place. Apart from that, it might be due to fallopian tubes blockage. And fallopian tube blockage, the picture of the uterus, there is a place that looks like ants and our arm. The place that looks like our long arm is what we call the fallopian tubes. So the place that looks like hand is what we call the ovary. The egg releases in the ovary. Fertilization of the egg takes place inside the fallopian tubes, and it will now move and come and embed itself. We call it morula in situ inside the uterus. And when it happens like that, what happens? It is there, and the baby begins to grow. But now, if there is a problem, maybe the tubes are blocked, the fallopian tubes are blocked, maybe due to infection, or at times there might be scar formation in the fallopian tube. For example, if somebody had a previous ectopic pregnancy. Ectopic pregnancy is that when the egg is released there, it comes into the fallopian tube, and the fallopian tube says, oh my God. And instead of moving straight to the uterus so that the baby can start growing, then they are maybe due to some things, maybe scar formation, maybe blockage at a particular place, it will just embed itself and start fertilizing right inside the fallopian tubes. And when it happens like that, what happens? There is a crisis. And what crisis is that? The crisis of ectopic pregnancy. So somebody, if you have, we have two fallopian tubes, and usually for most women, the right side might be more active than the left side. So if someone, for example, the right side is active and the person has had ectopic gestation or ectopic pregnancy or what we call it, and there is an operation, they have cut that place open to remove that ectopic pregnancy, it might be difficult for the person. How are you? When? Good evening. How was your day? It might be difficult for that person to be pregnant again because that's the active place. And now, because of ectopic pregnancy, they have cut the place open to remove what we call the ectopic pregnancy. So it might be difficult. At times, the ovary might be releasing the egg, but it might not be easy for it to pass through here because of scar formation. And at times, it might be as a result of cysts. There's something we call ovarian cyst. That cyst, there will be something like, we call them benign tumor. They will just be there. We call it cyst, polycystic ovarian syndrome. It's a syndrome. They have a whole lot of, and when we call it syndrome, it means it has a whole lot of symptoms. You understand? Not like you just have a headache. Somebody knows that you have a headache, it's only paracetamol. But when you have a condition like diabetes, a condition, they call it a syndrome, like Stevens-Johnson syndrome, there's another thing, various things that we call syndrome. So when somebody has PCOS, most of the time, most of them, you see them come down with male bear. They have bear, here. They have hair by their chest. Some up to their abdomen. They are so hairy. And because of that, their body recognizes they are male. It doesn't know that they are female. I treated someone about 5 or 6 years ago. She has 2 kids now. When I saw the picture, she's not even in Nigeria. When I saw the picture, she even told me, please, when you see that picture, delete it. because I was scared. She lost the first marriage because of that. It was serious PCOS. And most of them, they might just do menstruation. Like her own, she used to do menstruation just once or twice a year. And she was just 25 that she lost the first marriage. Then by the time she was 27, I think that marriage was over, and we started the treatment. And she asked to, she was even the one that said she know they do again. You understand? So PCOS is one of the things that can cause it. Then there is something we call fibroid. And that fibroid, if somebody has just fibroid that is within the inner layer of the uterus, oh, you don't know what God has done for you, because most of the time when it is removed immediately and they start what we call fertility medication or boosters or something, most of them get pregnant. But some will now go and have fibroid, the 3 layers of the uterus. The last layer is perimetrium, which is just like mama supporting the pregnancy or supporting the uterus when something is there. Then we have the muscle layers, the one that stretches out so that your uterus can accommodate 3, 10, or 20 babies as it were. Then the innermost layer, we call it the endometrium. That endometrium is where menstruation takes place, is where the baby will stay. You understand? So if there is fibroid, some fibroid, what we call multiple fibroid, is fibroid will be inside the 3rd layer, just like that. Then it will now be outside the 3rd layer, be at the back of 2nd layer, be inside the 2nd layer, be inside the 3rd layer, be at the back of 3rd layer, be just calculate. Some of them we call it subserous, some mucus, some bobos, because they are not, those ones are just wicked. I had a friend in Kenya, a Kenyan that is a South Africa, that is based in South Africa. The husband and her, both of them are men of God, and for a very long time we were encouraging her, because the doctor said there was only one solution, and the only solution was that the uterus should be removed. And so he took her, and she has not had any children. She has not had just one. So she was hopeful. But when the bleeding was much, because fibroid is associated with plenty of bleeding. So when the bleeding was getting out of hands about 3 years ago, I think 2022, she had finally agreed. And as at that time, she was over 50, for the uterus to be removed. And they went for surrogacy, and she's okay that she has one child. You understand? So if it is multiple fibroid, it is now winch. That one is crazy. But if it's just a fibroid that is staying just within the innermost layer, which is we call it, it is very easy. It's one of the reasons for infertility. Then another reason for infertility is what we call endometriosis. Some people too, when they are throughout the day, they might not even be able to stand. Their menstruation is more than ordinary dysmenorrhea. You know, we have dysmenorrhea where you just have cramping, and they say, come and take paracetamol, come and eat. You are able to eat. You can go to school. You can go to work. You can go out. You know, do your activities of daily living. But when we are talking about endometriosis, it means that the 3 layers of the uterus, the endometrium, which is the innermost layer, like we put 3 cups inside each other. The innermost layer now is what we call the endometrium. The myometrium is the muscle layer, while the 3rd layer is the perimetrium. Now, the 3 of them, because they have different function. Perimetrium is like mama supporting the house. Husband load na head. Children load na head. Everything as mama. That's perimetrium. Is the supporter, is the outer layer. It has different tissues. You understand? In our bodies, we have cells. From cells is from tissues, from tissues to organs, from organs to system. So that's why you hear some people saying reproductive system. When we're talking about reproductive system, the entire the penis, the male organs, all the female organs, all those one are reproductive system. Down to the anus, where people will come out, that is digestive system. When you now say integumentary system, that's skin, nervous system, that has to do with our spinal cord, our brain, and from cell to tissue, from tissue to organ, from organ to system. Now, the muscles of this hand is different from the muscles of my stomach. My stomach is my shaki, roundabout. That's shaki. The muscles are different. The one in the lung intestine, the large cells and tissues. Now, for the three uterus layers, they have different tissues. Perimetrum has different tissue. Myometrium has different tissue. The endometrium, they have different, because their job is not the same thing. Father, the job of a father is different from the job of a mother. The job of a mother is different from the work of the children. So there are, specifics. Now, endometriosis is now when the muscle of endometrium, which is the innermost layer that is baby, there's something now decide to go and it can go and stay inside the ovary that has no immediate connection with it. It's still part of the reproductive system, but it's just like this. You understand? Like you stretch your hand and the ovary is just within your hand. This is the cells, the tissue of your uterus that is here now work a problem with their uterus. If the uterus has its own issues, you understand, we call it an anatomical problem. You understand? Maybe your uterus is supposed to, it can go in, and what happens? Nothing. The person will just be there. So it's one of them. So apart from that, when we're talking about this, it can be as a result of prolonged usage of birth control pills. Because when the day you start using your birth control pill, apart from the female condom, we have two types of condom: the internal condom and the external condom. The external condom is the one the male uses, while the internal condom is the one that the female uses. Though it's not too common, but it's still there. You understand? Now, apart from that condom, all other ones, your body was actually going clockwise, and because you are not ready, you are trying to prevent or plan pregnancy. We don't call it unwanted pregnancy now. All children are wanted. Well, plan pregnancy, and you are telling your body immediately, you are taking all those pills or all those implants or IUCD. You are telling your body, don't walk clockwise, begin to walk anti-clockwise. You understand? So the hormones that are supposed to work for your ovulation so that you can get pregnant begin to work anti-clockwise. So at times you see most of them, they have taken the injection for like 2-3 years. When they are ready for actual baby, there won't be babies, and there will be fertility issues. Apart from that, when you begin to age in midwifery, as a midwife, if a woman comes to my clinic for pregnancy to come and register the very first time, and I have to ask, how old are you? And she says, I'm 23, I'm 24, I'm 25, that age range. I will just write priming gravida. Priming gravida means that this person is pregnant for the very first time. But if a woman comes in with a first pregnancy at 30, and she tells me that I'm 30 and this is my first pregnancy, those days when we use red biro, Now we use computers. I will just carry my biro, and what will I write? I will write, this is elderly primigravida. That this person having the first child at 30 is old though. So even if I'm not on duty the day she's going to deliver, whoever carries her file and sees, because it's the back of the file outermost, that I will write it up. You understand? It's like somebody is having allergy to something. That's the way we write it. In red biro. In red biro, nothing. Red biro in nothing means you should look deeper. There's something wrong. So I will write, this person react to chloroquine. This person is an elderly primigravida. Anybody that sees it, even my auxiliary that works with me, we know that there is a problem. If she has worked long in that labor room or something. So if they are going to give her the person that is 23, 24, 25, they are going to give her like 50% of care when she's when she's ready to deliver. That elderly primigravida, they can give her like 80% because that's her first time. Anything can happen. So she needs more hands, more dedication, more commitment. You have to be serious when you are doing that. That's what we're taught, and that's why we have been practicing it. You understand? Don't mind our attitude. Sometimes some of us, maybe due to pressure, you might not be able to cope with certain things and you misbehave. And some people will just say, nurses are crazy, nurses are mad. It's not all of us. You understand? So, aging, the higher you go, the higher the declination in your body system. Assuming you are releasing egg every month, by the time let's say you start your menstruation at, let's say 15, for example, and 15, by the time you are 30, you have menstruated for 15 years. And by the time they count the eggs that are released, though we might not know the number of eggs that are released per month, but let's say we assume it's just one egg. So by the time we count 10 years, we count 15 years, then you are not going to 30, 35, you have not had children, there will be decline. There's usually, it's just like the way we are entering menopause. Then the body begins to, get down. Maybe as we are growing, we're supposed to be strong. No, by the time you are 25, 30, you are doing gra. By the time you are 60, they don't need to tell you, say, daddy, no, they run again, mommy, cool down. Your bones, your body, your system begin to tell you and slow you down by force. They don't need to, nobody needs to tell you, you want to waka, let's see how it goes. You understand? So there's declination and reduction in our hormones, and of course the number of eggs that we produce, the ovary produces. There is something that we call ovarian insufficiency. I think ovarian insufficiency. That ovarian insufficiency, it gets to a stage as we continue to age. These days, I've seen people enter menopause 35, 40. If you are still lucky, your own will carry you 50, 55, 52. Rankadede. Most people now 35. Primary ovarian insufficiency. That's what we call it, POI. So that primary ovarian insufficiency will not allow your ovary that is supposed to release egg for you to get pregnant, will not allow it to function. Because there is always a trigger. Let's say I do my menstruation on the 1. And what we do is we count 5 days on the 1st, 2nd, 3rd, 4th, 5th as menstrual days. Either it finishes on the 2, like me, I do my period for 3 days, but we are still going to count 5 days. That's menstrual days. Then from on the 6th, 7th, 8th, 9th, 10th, we call it the resting phase, that your body is trying to prepare for egg. Therefore, some, if your menstruation is regular, it should be between 23. If your menstruation is more than 35 days, probably you are not ovulating. If your menstrual cycle is less than 23 days, it's possible you are not ovulating. So your menstruation, by the time you count on the 1st, your menstruation start on the 1st. By the time another one is starting, coming on the by on the 23rd, it's still okay. Coming 24, 25 till 35 days. But if it's now that your menstruation is by the time another one starts, or every month, you start menstruation on the 1st, by on the 20th, another one starts. By on the 18th, another one starts. You are not ovulating. We call it anovulation. Anovulation, that is absence of ovulation. So you are not ovulating. And if you now count, it's more than 35 days. This one come January 1. And to the end of January till 31st of January, there's no menses. You now see another one. Let's say on the 4th or 5th of February, you might not be ovulating. That is an ovulation. It's one of the reasons that somebody might not have viable pregnancy syndrome. That one will not allow the triggers, the hormones that we tell ovary that it is time for ovulation. Oh yeah, do your job. Will not allow it. And when ovary is not releasing egg, of course, there is no pregnancy. And at times it can be as a result of infection. You understand? If you have gonorrhea, for example, or you have syphilis, you have chlamydia, bacterial vaginosis, we have plenty of sexually transmitted infection, apart from yeast infection. Yeast infection are usually fungal in nature, but these ones are bacteria. So if you now have them and they are not properly being treated, and somebody tells you you are having issues, you don't even know whether it's gonorrhea, whether it's a toilet disease, anything that is just itching, based on people that have treated before. It's when we now go for tests, you understand, that we now say, this one is not a PID, it's not gonorrhea, it's not a vaginal toilet disease, thrush, vaginal thrush. It's after the investigation that we now know. And if those things are not properly treated, and there's something we call pelvic inflammatory disease, then the infection, because it's, let's say somebody now say, go and buy a concussion agbo to use, or you go and buy ampiclox bicham, amozil, all those most of those drugs that we use, they are not drug of choices when it comes to sexually transmitted diseases or infections. So, for example, I have gonorrhea. Somebody now say, go and buy ampiclox bicham. I just go and waste money, go and buy drug for 20,000, carry and come out. They use it. They do big man say, I don't buy drug. Now juju, because it will not work. And you know, our body has a way of coping. Coping is like, I'm going through stress and I don't want to sleep. Maybe I close from work, I did night duty, and I'm coming back. As I'm coming, I'll branch at the market. As I'm getting home, I want to cook. As I'm finishing, as I just finished cooking, I want to go and do my hair. As I finish doing hair, there is evening practice in the church. You understand? My body will not say, wait till be this one, you not rest. There are some hormones like adrenaline, cortisol. My body will be releasing it for me. So you go to see yourself as if you are strong, because the hormone will be acting like a substance that you are using, be giving you strength, because you don't want to rest. It will make you so alert that people will be asking, but you did night. It's those hormones. Is in the night when you now reach out, that your head will be making bang, 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 your leg will be making bang, that you know that you don't work out today. You understand? So it's just like that. When you're now using that ampiclox bicham with a sexually transmitted infection, though it's not the drug, but so far the bacteria sees that there is an antibiotic, they will sempe, you understand? They will go and gentle. They will go and stay in one place and be doing like good boys and girls, as if you are shouting on your children, go and sleep, go. And they just stand for a moment. But by the time they come back, you know what they do? When you finish your ampiclox bicham, they will now go and regroup and become 10 times stronger than the way they were before, because that drug did not catch them. Now, it will now spread. That's syphilis or gonorrhea will now spread to all your reproductive system, including your ovary, your fallopian tubes, the cervix, what is it called? The uterus itself. And when it now spread, that's why we now call pelvic inflammatory disease. That is, this disease has entered all the reproductive organs, pata pata, and it will be spoiling them. As soon as sperms gets there, the king no go, the sperm will just die, because this infection, water of infection, has entered the ovary, entered the fallopian tube. As soon as the egg is reaching there, the egg will die. There won't be children. And over time, it can even give the fallopian tube issues too. It can lead to blockage, it can lead to scar formation, it can lead to pelvic inflammatory disease blockage. Then, of course, what about abortion? Abortion is one of the things that will not allow someone to get pregnant on time. You understand? Because if you use drug, it might even be better, because it will just, at times it will just come like menstruation. But when you begin to probe the dilatation and curative, somebody begin to enter and they are forcing the mouth of the uterus, that's the cervix, they are forcing it. The dilatation means, you will see, if you have seen people do abortion or something, there is something like we call them forceps. They will, is a dilator. They will use it to force your cervix open. And this cervix, not they open anytime. It opens when the male organ enters our body. Immediately, it will touch. As soon as the penises enter, the vagina is open. It will touch the tip of the cervix, and the cervix open up so that sperm can come in. It opens when we are menstruating, because the blood that was actually coming is coming from inside your uterus, then gets into the vagina, and the vagina opens, and the cervix open from the cervix is the mouth of the uterus. It will now open. Then when the blood comes, it now comes to the vagina, and from the vagina, that's where we now see it outside to be able to clean it up. Do you understand? So this cervix opens up when the baby is about to be born, and they say 1 centimeter, one hand, one finger representing 2 centimeters. By the time we have 5 fingers, 4 representing 8 centimeters, by the time we have 5 fingers, they will say, okay, the woman ready, raise your leg, be in this position. We want to take delivery, you can push. We can't ask you to push when it's just 2 centimeters. You can't push when it's 4 centimeters. But when that means in that 10 centimeters, the head of the baby can come out. The parameter, the diameter and the parameter, they can come out as at that time. You understand? So this cervix is always like this. Is opening, is closing his mouth. That's why we don't have miscarriage. But if there is problem with cervix, miscarriage can come. But if you are pregnant and there's miscarriages, you have had 1 or 2, there is a surgery that they do that. You can even do it very cheap at one hospital that I know, FMC Butemeta. This one, 30 minutes, they don't finish them. So, but they have to be on bed rest so that the baby will not come down. And most of them, they will advise them to do cesarean section if they want to have their babies when it's about, 38, 36, or 37 weeks. Oh yeah, they might not even wait till the 40 weeks of complete gestation most of the times. So if there is a problem with cervix that cannot carry, cannot close mouth, you're already, all the sperm will just be coming outside. And at times there is a this thing, Yoruba call it a dauro, or something. Some people, as soon as they pour sperm, everything will come outside. There is none that will be able to retain for fertilization of the egg that has been released by the female ovary to take place. So we have a whole lot of issues when it comes to, it can be that the body itself is fighting against itself. We call it autoimmune disorder. When the tissue of a particular place is fighting with it. It can be that the ovary is having issue and fighting itself and is not able to release it. It can be that the endometrium, the innermost layer of the youth. And what happens if that is the case? Cannot stay. Then for the people that take birth control pills, most of the time, by the time you are not telling, I want to get pregnant now, or you have taken this injection or this implant, or maybe implant or no plant or IUCD, you have taken it for like 2-3 years. Your body has gotten to used to it. You were telling your body, don't walk clockwise, begin to walk anti-clockwise. Now you are stopping and you say, hey, yeah, what? So no go answer. So at times, all these family planning people that are still fighting that up to today, that their body has not returned back to normal. Then if you have abnormal menstruation, when we're talking about abnormal menstruation, it can be polymenorrhea. Polymenorrhea means you are having menstruation like 2 or 3 times a month. You have on the 1st, by on the 12th, you have another menstruation. By on the 20 something, you have another menstruation. Before you know, in a month, instead of 12 times, or maximally 13 to 14 times, you are now having your own menstruation is more than 20 times a year. You will not be able to get pregnant. If you have menorrhagia, that is excess bleeding. The first one is poly. You are just doing more menstruation than normal. But this one, the menorrhagia, there is this bleeding, no be here. There, it will be plenty. It's very common with people with that has fibroid. Very common with them. You see the bleeding at times. It's, some of the clots will just be as big as my hand. Yes, it will just poof, poof. So that is menorrhagia. And of course, you can have amenorrhea, no menstruation at all. No menstruation at all. So, and at times you can have scanty oligomenorrhea, scanty menstruation. Maybe you just do your menstruation just one day, tomorrow no blood, next tomorrow no blood, you just do like this. Most of the time, you might not be able to ovulate with that, and there won't be pregnancy. You understand? So that is why it is very important to do investigations to know, okay, we've been talking about this. So what investigation are we going to do? So you have various investigations. When they now do the investigation, or maybe your history, or you have done, and they're able to see, and they now say, oh, this is fallopian tube blockage, this is hormonal problem. Like I met somebody, it was a breast, the milk there. Somebody that is still looking for baby, no be here. He passed the person where they give breast, where they breastfeed baby self. So we have to start some medication, taking months, and the breast milk got dried. The body recognized that this person is not pregnant with that drug. It suppressed it. And it was until then that she was able to get pregnant. So it depends. We now treat it according to the cause. If it's fallopian tube blockage, you can do HSG, be hormonal booster. If it's like that, prolactin is the hormones of breast milk. They will use something to suppress it. And if you're a single person and you are seeing milk in your breast, don't even joke about it. Make sure it's treated so that by the time you are ready for marriage, it will be easy. Now we say, you now get there, you now begin what you are supposed to have done 5-6 years ago before you even get a suitor. It's now that you are now starting youth development programs, especially in universities, or yes, most of university girls. That's what I used to tell them in camp. If I go to start now, if you have it, so we treat based on the complaint or the investigation that we have done. So we have various investigations that can be done. You can do pelvic abdominal scan. You can do HSG, hysterossalpingography, whereby they go into the fallopian tubes, they can check the ovary. Are there cysts there? Are there? Do they have? Does the person have polycystic ovarian syndrome? Do they have POI, the premature ovarian insufficiency? Do they have prolactin pregnancy? Or the hormones that is supposed to allow for pregnancy is lower in the body? They are not up to the desired quantity. So there are a lot of investigations that can be done when it comes to infertility. And these days, there are a lot of options. If we now do this one, they have done this one, but those things are expensive. We have the IVF, we have the IUI, we have the surrogacy, we have the adoptive measures, a whole lot of things that people do now just to make sure that they, have their own offspring. You can do surrogacy, uh, you can do adoption. Adoption is very easy. You understand? All those ones. But for me, I can advise someone that's not gotten to 40, 45 or something to be trying for a adoption, except you have tried all options. And we see that all these options, but when you are still young, it is better to start on time and do something about it. You understand the Cynthia? Cynthia, are you still there? Cynthia, how are you? Are you still there? So that's just it. And maybe tomorrow we will now talk about the causes of infertility in male, because it's not only female that has infertility issues. Their own plenty brekete. So gone are those days that they just be cheating women. You are the one, you are the one, you are the one that is not allowing me that. It doesn't work like that these days. It happens to male too. So Cynthia, I don't know if you are there, you still have questions or something before we shut down and call it a day. Cynthia, I don't think she's there again. Maybe she has gone. All right. She's the one that wanted us to treat this particular topic, and I'm not seeing her. She came online, but she's not there again. So what do we do? Cynthia. All right. I know that somebody is there. Thanks for joining me. God bless you and see you same time, same station, same channel tomorrow. I remain your friend, Mas Folusho. Bye bye. Sweet dreams and good night.